Aorta is the artery that receives oxygenated blood from the left ventricle. And we learned that the first branches that emerge from ascending aorta are the right and left coronary arteries, those arteries that supply the wall of the heart with oxygenated blood. When we follow ascending aorta, then we end up with aortic arch, or we can say arch of aorta. And we see on top of arch of aorta, we have three branches. The right branch, which tends to be larger, wider, is called brachiocephalic trunk. Brachiocephalic trunk is basically the artery that sends oxygenated blood up to the right side of the head, neck, right shoulder, and also right upper extremity. The middle branch is called left common carotid artery. This is the one that supplies the left side of the head and neck with oxygenated blood. And then the left branch is left subclavian artery. We name it subclavian because when we see the rest of this artery, we see that it passes below the bone clavicle. Left subclavian artery supplies oxygenated blood to the left shoulder and left upper extremity. So these are the three branches that we have on top of the aortic arch or arch of aorta. And then the rest of aorta goes down, which we call that descending aorta. Recall, descending aorta is a very long artery. It passes through the diaphragm. Keep in mind that heart sits on the diaphragm. So what we're saying here is that the descending aorta passes through the diaphragm to get inside the abdominal cavity. The part of descending aorta that is above diaphragm is called thoracic aorta, and the rest of descending aorta that is below diaphragm is called abdominal aorta. So these are some main branches of aorta, and pulmonary trunk is the one that receives deoxygenated blood from the right ventricle. And we know that pulmonary trunk divides into two pulmonary arteries. That would be the left pulmonary artery that sends the oxygenated blood to the left lung. This would be the right pulmonary artery that sends the oxygenated blood to the right lung. In general, to tell which blood vessels are right and left, one easy way is to always pay attention to the location of vena cava. Vena cava, both of them, superior and inferior, are located on the right side. So that makes it easy for me to tell which of these blood vessels is the right one and which one is the left one.